So hello, this is the USP 2030 webinar series. And I would like to say good morning, good afternoon, or also good evening to all of you who joined us. It's great that you're here. Before we start with the presentations, I would like to give you a brief introduction of what's going to happen. And then we will continue with the presentation and hopefully a fruitful discussion. So as I said, that's the USP 2030 webinar series. It's organized by socialprotection.org in collaboration with the IPCIG. And what this series aims to do is to bring together practitioners and experts, and they discuss key topics related to universal social protection. We're discussing the current state, but then also we move forward and we look at the challenges and opportunities. So this webinar has the title Universal Social Protection, Achievements, Challenges and Opportunities. And here we will focus on the progress towards the achievement of universal social protection. And we do this here now really based on country experiences. So we have great panelists with us, which I will introduce them in a second, and they will share the experiences of Indonesia, of Kenya, and also of Brazil. As I said, it's the second seminar of this series. We started last Thursday already, and there we were with the World Bank, the ILO, and ODI, and looked at the concept of universal social protection. The institutions shared their perspectives on that, and they also made the link to the broader context of the SDGs. So if you could not join the webinar last week, it's still possible to watch it. We have the recordings, and you can also access additional material on socialprotection.org. In addition, you can also join the online community, the USP 2030 online community. And so you can keep track of the series and also see what's going to happen next. So there will be additional webinars on specific topics, for instance, digital social protection or gender sensitive social protection. But today it will be with Indonesia, Kenya and Brazil. So first we will look at two country experiences. And we have experts from Kenya and Brazil, and they will let us know what social protection looks like in their countries, what has been achieved so far, what are the bottlenecks that they face with regards to achieving universal social protection, but what are also the next steps that they plan to achieve. And for Brazil, we have a researcher with us, Rafael Osorio, and he will focus more on reprogramming. So how can we also achieve better outcomes by having a different way of putting these programs together. In addition, the series will result in a special edition of the Policy in Focus magazine. It's the IPCIG flagship publication, and it will focus on universal social protection. And the participants, the panelists, they will contribute to this next issue. So what we really would like to do is to encourage the audience to send us many, many questions that they would like the panelists to answer. And in addition to that, if there are questions that we cannot address during the webinar, there will also be then later a document where we will share answers to the remaining questions. So let me briefly introduce our panelists. We will start with a presentation by Mr. Maliki. Mr. Maliki is the Director for Population Planning and Social Protection in Indonesia. This will be followed by Cecilia Mbaka from Kenya. Cecilia is the head of the National Social Protection Secretariat in Kenya's State Department of Social Protection. And then finally, we will have another presentation by Rafael Osorio on Brazil. So before we start now, just to let you know, we will have 90 minutes now. Each panelist has 15 minutes for the presentations, and the remaining time we will have for our discussions and our Q&A session. So, Mr. Maliki, would you like to start with your presentation, please?
Okay, thank you, Mira. Nice to meet you all the guests. I'm Maliki from Indonesia. I would like to present the Indonesian policy of the social protections towards how we can achieve these universal social protections in 2030. I hope the sound is clear enough. How to... Okay, next slide. Okay, how can I control the slides? I'm sorry. Okay, Indonesia has quite a long history because the social protection itself is mandated by the law in 1945 that can be shown in the next slide, please. Next slide. Okay, so in 1945, I think the social protection has been mandated that all the poor and vulnerable are protected by the government by providing them with the social protections. And not until like 2007, we formulated the long-term development planning that is clearly mandated how we have strategies on securing all the citizens by the social security programs, as well as that we have to empower the poor and vulnerable towards become like a dignified community. And the most important part is how we can integrate the social security and also social assistance and cover the informal sectors. And then the last part is that the social security and also the social assistance is have to be implemented by cooperation principles for the implementations. By those long-term development planning, we have a strategy towards the comprehensive social protections. Is that we are going to strengthen the institutional of the social security system, and then restructuring of the social assistance, development integrated social protections, as well as how to increase the inclusivity of disabled coverage. Can you put next slide, please? Next slides. As you can see from the slide, is the history is quite long from since like the reform in 1994, becoming the reform in 1997, and then now we have a new cabinet. The social protection is studied by like protecting some of the segment of the population, especially for the pension program for the government officials, as well as how we can also provide them with the health insurance. And then by 1997, we actually already developed, because of the economic crisis as well, we are pushing to have like a social safety net health support and some other support that protect all the poor people. And now in the new cabinets, we have quite comprehensive schemes of the social protections that including the social assistance and also the social insurance. Can you put in the next slide, please? This is the plan for the 2015-2019 that have been done for the next the 5 years, and we actually towards the new cabinets for 2020 and 2024. In Bappenas, we are formulating the medium-term development planning for 2020 and 2024. But before we are going to the next cabinet, we are looking at this the new this current medium-term development plan that covering comprehensive social protection strategy, as well as how we can improve the livelihood of the poor and the vulnerable. There are 3 strategies that will aim to reduce the poverty, vulnerability, as well as the inequality. That's why we have for towards like 2019, for this year, by the end of this year, we need to reduce the poverty rate to 8.5 to 9.5. as well as how we can reduce the Gini ratio for become around 0.385. There are three strategies. We are improving the social security and also the social assistance. And then we also facilitate the basic infrastructure as well as how we can improve the public services. And then the last part is how we can improve the livelihood of the poor and the vulnerable. For the social security and the social assistance, we are, for the last 5 years, we've been developing the social health insurance and then the social employment insurance. And then we also provide some of the social assistance, which is including most of the human capitals development, which is education support and then health support, as well as how we can make sure that all the support is being implemented, and as well as how the families also comply with the human capital development by giving them the conditional cash transfers. And some of us, we also are starting to have the social assistance for the children, elderly, disability, and also the indigenous people. And then the next slide, please. Especially for the social insurance, for the national social security, the last 5 years is the most important stage that we have been implementing the social insurance that have been regulated in 2004, but effective year implementation is 2015 for the social insurance for the labor, and 2013 for the national health insurance. This one is already have been so supported so many people, especially for the national health insurance, that covering almost around 80% of the population now. Next slide, please. Next slide. So, I mean, as you can see that it's already been like so comprehensive, and the history is quite long, and the government is actually focusing on the vulnerable people. That we are focusing 40% of the poor people. If by the law the cash transfers or the subsidy are directed to the poorest 40%, and the social insurance is supposed to be cover the whole populations. But as you can see that some of the people, especially in the middle, 40% is not really what we call this is unseen, because in some of the informal sectors, that is basically mainly in the middle 40% is not covered by the social insurance because of their affordability, as well as that in terms of the social assistance, the government cannot support them. So this is one thing that is a challenge for us on how we can actually improve the protections of the middle income. Some of them is because of the financial constraints for the paying from the premiums, as well as how we can also improve the insurance literacy, as well as administration, some of the administration problems. Next, please. And still like actually the coverage of the social protections is still in the middle. This is only the numbers, the numbers of the coverage. So the number of households is already included like 26 million for the 40% below. And the number of family is around 28, and number of population that have been supported by the social assistance as well as the assistance for the premiums for the social insurance of the health is including around like 96.83 millions. While if we can see that the middle class have quite significant numbers as well, that consisting around 21 millions of the formal workers and 27.4 millions of informal workers. Especially for the informal workers, the coverage of the social insurance for the laborers is only like 2% of the coverage. Next, please. Next. So this is the how we can like mapping the achievement, the current social protection coverage. Some of like the yellow part is the one that has been like existing coverage, and the purple part is those is not still not coverage and become a targets in the next periods. As you can see that the one of the programs like in the middle, we call it Village Fund, is hopefully it is can be one of the basic foundations on how we can support the village at the village level for the village people. And some of the subsidies actually is already been dispersed for quite like quite high coverage, especially for the gas and electricity water coverage. For the other part is, some of the challenges for us is on how we actually can improve the informal sectors for the social security programs. But one thing is that have been quite remarkable progress is on health insurance. We already have like around 80% of the coverage of the national health insurance, and that one is like the biggest. I think that is the biggest health insurance in the world too. Next slide, please. What have been like doing for 5 years? We've been achieving to reduce the poverty rate to 9.66% in 2018 and 0.384 for Gini ratio in 2018. And we are looking forward for further reducing for this poverty rates until the targets in 2019 for 9.5% is improved. And I think we are very optimistic on this one. Next one, please. Next. So this is the next terms for the 5 years, and what we are formulating in Bappenas now. We are formulating the medium-term development plan for 2020-2024. The strategic issue is on how actually we can target and how we can provide like more, develop more strategic financing, and how we can improve the coverage of the recipients, and then also how we can improve the institutional framework of the social protections. There are a few main strategy of how we can strengthen the comprehensive and integrated social protection. One is how we can improve the institutional building on planning, budgeting, and monitoring, and evaluation on social protection. We call it Sepakat, and it has been implemented in almost all of the provinces in Indonesia, and we are looking forward for the whole coverage of the provinces in the next medium term. And then we also have the single window services, integrated data, complete resolution and services for the whole more integrated social protections, especially social assistance and the social security. And because of the most recent damages because of the earthquake in Indonesia, we are in the next term, we are going to have more like adaptive social protections that can protect the most of the people that is vulnerable because of the climate change and also the earthquake. And then we try to increase the coverage of the informal and disabled, especially for the social insurance, and also how we can make all of the job markets is inclusive for the disabled people. And then the last part is how to improve a social insurance benefit. We are trying to formulating for the next term return to work for those who actually or have an accident and become disabled, and then pension for the informal workers, unemployment insurance, and the long-term care for the elderly. Because of the Indonesian, I think the next decade will be an aging. Just next slide, because this is already, I think I already ran out of time. Can you put in the next slide? Next slide, please. Next slide. Okay, so we are trying to improve the coverage of the informal sectors. We are trying to not only like involving the government, but also for the non-government. That's why we need to find more like comprehensive sources of funding. One is we are trying to finance with the tax finance for all the social assistance. But some of the social insurance, we are trying to looking forward for like a co-sharing, also matching defined contribution with the companies, with the informal sectors. And also we are trying to have the philanthropy-based funding to cover up of this missing middle for the informal sectors. And for this strategy, we are trying to strengthen the finance institutions as well as the education and vocation for the private companies. Next slide, please. Next. Okay, this is the last part that how we can set the target. So our medium-term development plan is like in the middle of achieving the 2030. So the pillars, the strong pillars and achievement in the next middle terms is quite important. That's why we have to be more robust, as well as how we can find like not business as usual approach for improving the coverage of the social protection for the whole people. In Plan 2020 and 2024, we are trying to improve the targets to, like for the health insurance or the national health insurance become 98%, and how we can improve the coverage of the proportion of the insurance, social insurance for both formal and informal become more than higher than 50%. And also for the social security carrier, we are trying to improve their fiscal sustainability. And the last part is actually how we should integrate social assistance and subsidies towards better implementations. Hopefully in 2030, we can achieve the social protection system for all, and then also we need to improve the fiscal, wages, and social protection policies. I think that's my presentation. Thank you.
Great. Thank you very much, Mr. Maliki. That was really, you provided very good insights into Indonesia's social protection system. And I found it particularly interesting how you highlighted the issue of the missing middle, and how you aim to tackle this challenge. So we have already received some questions, but we will collect those questions and then answer all of those during our discussion. For now, I would like to ask Cecilia to continue with her presentation on Kenya.
Thank you.
Okay, thank you. I went straight to the questions that you had posed to us, and like Indonesia, that gives some background information. If we can go to the first slide. Okay, one thing I would want to say is that as a country, we have a policy on social protection, which was developed in 2011. And it has a very long definition of social protection because, as you all know, around 2011, that is when social protection was starting to take shape. In fact, for us as a country, we had just been piloting some programs. We didn't have any policy when we started in 2005. And so our policy on social protection defines social protection as policies and actions, including legislative measures that enhance the capacity of and opportunities for the poor and vulnerable to sustain their livelihoods. And if you look at the definition, it stands on 3 pillars. It stands on one of the pillars is social security, social assistance, and then health insurance. Now, we have been in the process of reviewing our policy to align it to align it with issues that have emerged. And as we have been implementing the current policy, our feeling has been that the definition in the current policy is very broad, and so we were having some challenges on the implementation. And so as we have been reviewing the 2011 policy, we have tried to narrow down the definition, so that now it reads a set of policies, programs, interventions, and legislative measures aimed at cushioning all Kenyans against poverty, vulnerability, risks, contingencies, and shock throughout their life cycle. So the emphasis here is on a life cycle, and also the emphasis on really cushioning all Kenyans and not selected Kenyans, because poverty dynamics keep changing. At some point, the poor, Kenyan people will be well off, and especially considering the context that we live in Kenya, where much of our land is either arid or semi-arid, and especially in the arid and semi-arid areas, the poverty levels keep fluctuating depending on whether the population in those areas, depending on whether there is rain or no rain in those areas. Next slide, please. Yes, as I said in the definition, we have a mix of both contributory and non-contributory social protection, and our policy on social protection recognizes this. We have social assistance programs, which will mainly be either cash transfers or subsidized farm inputs or feeding programs, education bursaries, public works, which are mainly funded by the taxpayers, while the social health insurance and social security are contributory schemes. But I would want to say that the government of Kenya has gone a step further and has made a policy commitment to provide a health cover to persons who are aged 70 years and above, who are also receiving the cash transfer program. Next. Next, please. Yes, as I said, Kenya has a social protection policy. When we were developing the current policy, issues of universality were not very prominent. In fact, we were still struggling with the targeted programs. However, we have been making efforts to on universal coverage. For example, in 2017, the government of Kenya made a commitment to provide a universal cover to all the persons who are aged 70 years and above. That program is currently doing very well. About over 500 beneficiaries are accessing the cash transfer for older persons, about 500,000, slightly more than 500,000. The other thing is that our constitution is very clear on issues of universality. One of the articles of the constitution provides that every Kenyan has a right to social security. And for us, social security here encompasses both social assistance, social security itself as a contributory scheme, and social health insurance. And in another article, the constitution also states that the state shall provide appropriate social security to persons who are unable to support themselves and their dependents. And so what we are currently doing as a country is to try to see how we can give effect to these constitutional provisions. And that's why gradually we are introducing universal coverage. As I said, we have just rolled out a universal cash transfer program for persons aged 70 and above. And gradually, I believe that with physical space allowing, we should be able to move to see other universal cash transfer programs being introduced. Next. The other question that you wanted us to address ourselves to is how our country measures its progress towards the target 1.3. And just to remind us, goal 1.3 commits government to implement nationally social protection systems and measures for all, including by 2030 achieving substantial coverage for the poor and vulnerable. I'll therefore be sharing with you what we have been able to achieve as a country. Next. Yes, at legislative and policy environment, as I said, we already have a policy on a National Social Protection Policy 2011. And the policy is under review to capture issues that have emerged. We also have a Social Assistance Act of 2003, which we are also reviewing. And as we review it, we're trying to see how we can roll out a fund to support social assistance programs, which are non-contributory programs. We are also in the process of amending the Social Security Act to address issues of informal sector, because what is happening currently in Kenya, majority of the workers in the informal sector are not contributing to Social Security. We only have about 10%, and that is something as a country we need to do a lot of advocacy on, so that we can have more Kenyans contributing to Social Security. We are also in the process of reviewing the NHIF Act to address the issue of extending coverage to all persons. And as we speak, the government of Kenya is in the process of rolling out a universal cover for all Kenyans. And we already are doing a pilot. And after the pilot, it will inform the rollout, which should be very soon. Next. On institutional development, we have a State Department for Social Protection, which was established in 2016. And there is also further strengthening of the same by incorporating Social Security, that is the National Social Security Fund, under the same roof. We also have a National Social Protection Secretariat, whose responsibility is to undertake activities that provide policy direction and also coordinating the sector, considering that this is a very wide sector with very many players. And so the Social Protection Secretariat is expected to provide a platform where the various stakeholders can come together, they can share experiences and lessons that they learn. I mean, lessons for purposes of informing each other. We also have a framework that we have also created, the Social Assistance Unit. Previously, our cash transfer programs used to run under different departments, which was very expensive for us as a country. And so in 2016, we made an attempt to bring all these programs together so that they can run under one roof. And with that, we found ourselves more coordinated and saving a lot of resources as a result of having the programs running under one roof. We have also established a National Steering Committee on Social Protection that is supposed to advise on what is happening in the sector. Next. Next, please. At programmatic level, we have also seen a lot of progress. We are seeing a rapid increase in the number of social protection programs and interventions in the country. And this is as witnessed by the increased number of social protection actors. The quality of the programs has also improved due to better design and techniques, because we have been running cash transfer programs for over 10 years now, I think about 14 years. And as a result of that, we have learned lessons, and every time we have made attempts to ensure that we improve the quality of the programs. For example, with our cash transfer programs, previously when we started, we used to carry money from our national treasury and we could go pay the beneficiaries. From there, we moved the payments through the post office, which are decentralized up to the grassroots level. But in the recent times, we have engaged 4 banks that are doing the payments, and our beneficiaries have a choice of the 4. I mean, they can choose the bank that they want to go to. And if the banks are not serving them well, they have an opportunity of moving from one bank to the other. And the banks are competing because it is the quality of their services that will determine whether beneficiaries will remain with them or they will move to other banks. And that competition is good because it gives them an opportunity to ensure that they are giving good services to our beneficiaries. I have talked about the universal program. The other thing we're doing at programmatic level is really to increase, to think about the issues of sustainability. And we have developed an investment plan towards the Vision 2030, where we are looking at the kind of initiatives that we shall be making on social protection and the kind of resources that they will be requiring. That investment plan is in place, and we're hoping we can have it tabled at the cabinet for adoption so that we can be able to roll it out. We also have ongoing discussions on sustainable financing options, because as our programs expand and we made a very ambitious investment plan, we would want to ask ourselves, where are the resources going to come from? So we are currently having discussions on how we're going to sustain social protection, and our thinking is that we need to establish a social protection fund to be able to fund our social protection programs, especially the contributory programs. Next. We have also developed systems that are to increase efficiency and effectiveness with the way we are delivering social protection programs. We have management information systems at program level and at the national level. At the social protection level, where we that's supposed to be coordinating social protection programs, we have the single registry, which is a central depository of data. It is currently hosting data for 5 cash transfer programs. And moving forward, we're looking at even linking to other programs, either run by the government or non-state actors, so that they can be able to inform each other. The cash transfer programs also have the Consolidated Cash Transfer Program, MIS, and other contributory schemes also have their own management information systems. And moving forward, we're trying to see how they can all link to the single registry, so that, as I said, they can be able to inform each other. And the way also is the development of a social registry. Unlike that, we're thinking of establishing within the single registry. And the social registry, unlike the single registry, which is currently hosting data for already existing beneficiaries, the social registry will host data for potential beneficiaries. So that, for example, if any stakeholder would want to to reach out to the poor to establish social protection programs, they don't have to go very far. They can come to the Social Protection Secretariat. They can identify, they can pick up the data that they want, and they can go to the grassroots level or wherever it is, and they can enroll the beneficiaries. That is something that is underway. We have also developed a national monitoring and evaluation framework. And as we think about this, it's about the whole sector of social protection, not necessarily social assistance. It has been developed, and we are already in the process of implementing it. Next. We are also seeing more increased government ownership and financing of programs. Initially, we had some programs funded by other stakeholders, and especially the CTOVC and the Hunger Safety Net program that is run in northern Kenya, where we have semi-arid lands. We have seen the government gradually take over these programs, and they are all now funded by the Exchequer. We also seeing more investment for social assistance programs, as well as spearheaded reforms in both social security and health insurance. If we look at the spending for cash transfer alone, we have seen increased funding from about 7 billion Kenya shillings to about 26 billion. The exchange rate for the dollar to the shilling is about 100 Kenya shillings. Next. Now on bottlenecks, as a country, our poverty levels are still quite high. Although we saw a reduction between 2005 and 2015, where poverty levels reduced from 46% to 36%, that 6% is still a big percentage. And so one of the challenges that we are having is high demand for social protection, coupled with increasing national priorities. So we find that we still have people who would want to benefit from the cash transfer programs, but because of limited physical space, then we are not able to do that. Although we have been struggling to put systems in place, I think we are not yet there. Our systems are still weak, that are meant to increase efficiency. Because although, for example, when it comes to payment, our beneficiaries, for example, for the cash transfer programs, are not supposed to move to a distance that is more than 6 kilometers. We are still seeing some of them moving to long distances, but I think this is something that that we can work on gradually. We still have weak coordination mechanisms, although we have the Social Protection Secretariat in place that is trying to strengthen coordination. We're not yet there, and I think this is something as a country that we really need to work on, so that we can strengthen our coordination mechanism. We can be able to know who is doing what. We can be able to avoid duplication, and together we can be able to see, to come together and see what we are doing as a country. As I said, majority of those informal sector are not contributing, and we so know when they don't contribute, then they become potential candidates for cash transfers at a later date. Still on challenges, as I keep saying, we have limited physical space. As a country, we would want to see more people covered, which is sometimes is not possible. There is also the mentality that social assistance creates dependency for those of us really who do not understand what is social protection. At design stage, some older persons who are supposed to benefit from the universal cover for 70+, some of them were left out due to limited resources, like we had to leave out those who are already on a government pension. As I said, we also have weak systems, sometimes delayed payments when we get delays from the Exchequer. And sometimes we use caregivers for those older persons who cannot be able to manage themselves. Sometimes there is a bit of lack of transparency. Next. So what have we learned? There's a lot that we have learned, that there's need to entrench universal social protection in various legislations and policies, so that successive, because when they are entrenched, then chances of them just not continuing will not be there. Then strengthening coordination and linkages is very important. Creating systems to increase efficiency is also very important. We've also learned that universal social protection reduces poverty and vulnerability, because, as I said, our poverty levels have gone down, and this is partly attributed to the cash transfer programs and other social assistance programs. We also have seen reduction in inequality through social solidarity and income redistribution. Need for a life cycle approach to ensure nobody is left behind, which is and then strengthening collaboration between national and county government. In Kenya, we have a national and county government, and it is important that they all work together to ensure that the right beneficiaries are reached. Thank you.
Cecilia, thank you very much for this very rich presentation. And I'm sure there are many points which are interesting for practitioners in other countries as well. So as I said, we now continue with the presentations first. And I would like to ask Rafael now to join us with his presentation on, or to share his ideas on how to expand and improve social protection in Brazil.
All right. Can you hear me?
Yes.
Yeah.
Okay. Good morning or good afternoon, wherever applies. It's a great pleasure to be here sharing this session with Maliki, Cecilia, and Mira. So I'm going to start right away because we don't have too much time. So if we can move to the next slide, please. So in the last 50 years, many mechanisms, many programs of social protections were institutionalized in Brazil. So we had an expansion of social transfers for low-wage workers, the introduction of non-contributory old age and disability pension, and transfer to poor families. So lots of things. We could be talking about all of them for hours, and I've been working with social protection in Brazil for many, many years. And once in a while, I found out that there is something that I didn't know about. So there are really many, many things. But what I want to recall is that in the beginning of 2003, we already had three targeted cash transfer programs. We had Bolsa Escola for education. We had the Cartão Alimentação that was in the Ministry of Health. And we had Vale Gás, that was a fuel subsidy for poor people. So, and still in 2003, the new government, when President Lula was initiating his first term, Brazil decided that it would create a fourth targeted cash transfer program, which was to be part of Fome Zero. But back then in 2003, we were going through an economic crisis. I guess not as bad as the one that we are going through now, but it was a problem for the new government. So how were they going to create a fourth cash transfer while there was no fiscal space for anything? It was a period where the economic policy was one of extreme austerity, to pave the way for the growth that happened in the following years. But fortunately, someone with brains in the government, there were good people working there, and they noticed that that was not reasonable at all to have like 4 different targeted cash transfer programs, and they decided to propose the unification of them, and the government then bought this idea. So Bolsa Família was born as the merger of 4 different targeted cash transfers. So they were merged, but both the budget and the operations were merged then. And still, this is curious. Of this, just 4 programs that generated Bolsa Familia, only one of them was terminated. So Bolsa Familia is like is still formally a Frankenstein made of 3 different programs. But this was a nice example of doing reprogramming as a way to create fiscal space. So we had a government that was starting. It wanted to do something different to have an impact, but it had no resources. So how to create fiscal space for these new things that they wanted to do? They did it through reprogramming. They looked at the programs that existed and which ones were doing the same thing, not as good, and how could they improve the operation of this program so they could have a larger impact on poverty and inequality. So let's move to the next one, please. Yeah, the next slide. So one of the Bolsa Familia's most important outcomes was the development of the Cadastro Único, the single registry. So today, it's amazing. The majority of the poor and vulnerable Brazilians are in the Cadastro Único. It's more than 80 million people. And most of them are participating in one of the more than 30 social programs that are now using the Cadastro Único to select beneficiaries based on household income, self-declared household income. That's how we do targeting here in Brazil. So what is interesting is that in the beginning, there was a lot of concern with frauds in Bolsa Familia. So like everywhere when a cash transfer is launched, people were concerned about like families will get lazy, they will quit the labor market, they will start to have children like rabbits and everything, blah, blah, blah. People will lie to get the benefits. So there was a lot of concern with frauds in the beginning. Still there is. And because of this concern, people went, start within the government, like the audits bodies and even people from the ministry, they started to cross-check the database of the Cadastro Único with other databases, you know, to check for hidden sources of formal income that the beneficiaries might have failed to declare or might have plain lied about it. They didn't disclose those sources of formal income, and also to seek for other determinants of ineligibility, like you cannot be an elected politician and receive Bolsa Familia, you cannot be a civil servant and receive Bolsa Familia. So they started to do all this cross-checking with other databases. And one very interesting thing is that they soon found out that the Cadastro Único had a quality far superior than that of the other databases. So a famous case is that they found out that some beneficiaries of Bolsa Familia had fancy luxury cars. And when they went to visit these people, they found out that these people were being used by other people who were the real owners of the car, so as a way of hiding their wealth. So actually, people were seeking for frauds in Cadastro Único, and they started finding frauds in other registries of the government. But anyway, although this was bad in a certain sense, because it means that most of the people were concerned more with about inclusion errors than about exclusion errors. It was good because this led to further integration of the Cadastro with other registries. This led to technological developments. And now this has come to a point where all the most likely formal income sources of all members of a household can be checked even before a benefit is granted. So this is being done today. And for the next version of the Cadastro Único, the 8th version that is being discussed and debated right now within the Brazilian government, the idea is that at interview time, when the family, the responsible for the family, person responsible for the family declares the identification numbers, the system will return to the screen all the incomes that this family is supposed to have. So the family can say, all right, this is like that, we have all those incomes, but the family can also complain, because sometimes we know that the information on the databases is outdated. But this was a big development, because this is something that people usually don't see, but this means that the Brazilian government has an outstanding instrument, because I mean, like most of the poor population, almost half of the Brazilian population is there. So if the government wants to tackle poverty and inequality, it doesn't need to go out and find the poor. The poor are already found. You already know where they are, where they live. So it's just a matter of doing something for them. But anyway, can we move to the next slide, please? So the Cadastro Único is a far better way to target the poor and the vulnerable, and the targeting mechanisms that were used by other programs, and I'm putting programs between double quotes because some of the things that we are going to be talking about are not real programs, like the deduction that you can do for every child in your taxable income. But anyway, those programs, they also targeted the poor and the vulnerable, but they did it using other mechanisms. For instance, the Abono Salarial and the Salário Família, they targeted low-wage formal workers. And the latter can be received by beneficiaries of some social protection transfers as well. Like if you have an old age pension and you have a 0 to 14 child, you can receive the Salário Família if you have a pension with a low value. Well, even the per child deduction of the annual taxable income when it was created in 1956 was a way of targeting less, well, that's strange, affluent families using the presence of children in the household as an indicator. But as we shall see, those programs, although they were targeting children, the poor, they are still targeting the children, the poor and the vulnerable, they consume a lot of resources and they do not have the distributed performance of Bolsa Família. Can we go to the next one, please? Okay, so these are the figures for Bolsa Família. In 2017, we had 43 million beneficiaries. We transferred 29 billion reais for these people. And on the side, you can see the distributive profile of this benefit. So 77% of the benefits of Bolsa Família go to the third poorest, the 33% poorest members of the Brazilian society. 21% go to the middle, and very a negligible amount of the benefits leak to the top third. So it's very good targeting. This is for families that have household income per capita below 178. And these families were receiving, this is important for us to remind, 41 per child or pregnant or breastfeeding women. There's a cap at 5, but it's very hard for a household in Brazil to have more than 5 beneficiaries with this characteristics. So this cap is almost as it doesn't exist. Then you get 48 per each youth. And if the family income, declared income, was below 89, that is half of the eligibility threshold, the family gets 89, but not per capita, per household. And after all transfers, if the income of the family, so declared income plus the benefits, is still below the 89 extreme poverty threshold, then the family gets an extra benefit to bridge the remaining poverty gap. The other thing about Bolsa Família is that families enter to participate for 2 years, and in this 2 years period, their income can go way above the eligibility threshold without they being shut down from the program. The next one, please. This is Salário Família. This is not as well known as Bolsa Família. This was created a long time ago, but it's still, it has like it's very hard to estimate the figures for this program because there's not much information. So this is like an exercise. But anyway, like 5 million beneficiaries transfer 2 billion every year. When you see the distributive profile, we see that it's not benefiting the poorest families. It's going to the middle of the income distribution. Why? Because it targeted formal workers and pensioners, people that have a benefit from Social Security. So the benefits should be less than 1,300 reais, which is a little bit more than one minimum wage, which is 90.37 in that year. But all those beneficiaries are entitled to receive 32 reais per child. And this 32 reais should be conditional on health and education, but this was never enforced, never enforced. So the idea is that the child should have their immunization card up to date, all the immunizations, and if in school age should be attending school, but this was never enforced at all. Another curious thing about this benefit is that if the father and the mother are eligible, one child can yield 2 benefits. So this is another curious thing about, but you see that Salário Família should be for poor families, but it's not for the poorest families. It's for the middle, for families in the middle of the distribution. Why? Because everyone in Brazil that gets a minimum wage, if a household has a minimum wage recipient, unless it's a very large household and it has only one recipient, this household will most likely be above the median of the income distribution. Next slide, please. So this is the really bad one, abono salarial. Abono salarial is given to formal workers that earn less than 2 minimum wages. Nothing else is required, regardless of household income, size, demographics. So these people get an average of almost 80 reais per month. So this is a lot of people. It's almost 21 million people that received it in 2017. It transfers 17.4 billion reais. It's more than half that of Bolsa Família, and it has a very bad distributed profile. You see that 39% of these benefits go to the top 33% of the income distribution. So this is very badly targeted. Why? Because most of the formal workers that receive 1 to 2 minimum wages, they are not necessarily in poor families. Some of them are secondary workers in affluent families. So these families are not poor, and there's no reason at all why we should be paying these people this abono salarial anymore. When it was created, the minimum wage was less than 1/3 the current value, and many families had only one provider of income receiving 1 minimum wage. So it made sense back then. Particularly considering that you didn't have other ways of targeting the poor population like we have now. But today, this is something that makes no sense anymore. Let's move to the next one. So this is the most absurd one that we have. So in Brazil, the rich people got their Bolsa Família in 1956. So since 1956, you can deduct a certain amount of your annual taxable income per child. Actually, you can deduct per dependent. So if your father or your mother live with you, you can also do this deduction. But here we are presenting the figures just for children. So we estimate that we have almost 11 million beneficiaries. This is more than 4 billion every year, and this is for the rich. So you see that 99% of this benefit go to the top 33%. And we could, if we were doing a fine graining of this, the income distribution, we would see even a worse situation. Worse than that, as people with higher income, they pay higher taxes, and you deduct this amount from your annual taxable income, this means that people that pay higher taxes, that have higher income, they get higher benefits. So if you are in the lower bracket of taxable income in Brazil, you're going to get 14 reais monthly for every kid you have. But if you are very rich, you're going to have 52, which is more than what is paid for Bolsa Família. So please, next one. Next slide, please. Oh, so if we see these 4 channels of the distribution of resources together, okay, not counting the overlapping, we just adding them, it's 80 million people, and we are transferring 52, almost 53 billion every year. And we see that this has a very bad distributed profile. Actually, because of the abono salarial, the Salário Família, and the tax deduction, most of these benefits are going to the top third. Okay, and there's a lot of overlapping as well. Like 40 million people are in households with overlapping benefits. So you have like a 15 million people in households that receive both the abono salarial and Salário Família because they are essentially programs for the same public. So if someone that receives the abono salarial with 1 minimum wage also has 0 to 14 children, this person most likely is going to be receiving Salário Família for these kids as well. The next one, please. So by this distribution through this 4 channel, what is Brazil achieving? So There is a mild reduction of inequality. After these transfers, the Gini falls from 55.4 to 53.7, and there is a non-negligible reduction of extreme poverty at the 1.9-day poverty line. So the head count in 2017 falls from 7.4 to 5.9. But almost all the this reduction of inequality and poverty is produced by Bolsa Família. So Brazil could be making a better use of these resources if all was distributed to Bolsa Família, for instance. So I and some other IPC researchers, we are finalizing a paper where we present all those estimates, and we are suggesting that Brazil should unify these 4 programs in a single operation, in an integrated system of non-contributory benefits, which would be like a super Bolsa Família. Next one, please. So in this paper, we are discussing everything, all the details that I couldn't be discussing here because we only have 15 minutes, and I didn't I was with the watch here, but I didn't notice when I started, so I don't know how long I have been speaking. But anyway, we discuss everything that we need to unify those 4 programs, from administrative measures to legal changes, because you have to, for instance, amend the constitution to unify these programs, because some of them are in the constitution. So, but we see this just as a first movement, because there are many other programs in Brazil. There are obvious candidates to be merged into this new program, like the Benefício de Prestação Continuada, which is the Brazilian old age and disability pension, which was part of our initial package, part of the initial proposal that we were making, but then we withdrawn it because we noticed that the political obstacles for reforming BPC right now would be far greater than for the other 4. So in the last 6 months, we have been fine-tuning this proposal, discussing with the relevant government stakeholders, like with the people of the Ministry of Citizenship, which is the new name of the Ministry of Social Development, the people that run Cadastro Único, Bolsa Família, the people that work with social assistance, so we could get their feelings about this. So we are like talking to everyone to see how we can build up a proposal that will face less resistance, that is more able to produce a consensus. So we are discussing also with the Ministry of the Economy and also with members of the parliament, with parties from the left to the right. Next one, please. So in this proposal, we are presenting 2 new benefit designs for Super Bolsa Família. We are not strongly advocating for any of these benefits designs. They are there just to illustrate that Brazil can do more to fight poverty and inequality without the need to increase the amount of resources currently allocated to child welfare and anti-poverty programs, just for reprogramming. So we did a lot of ex-ante simulations. We chose just 2 because, I mean, too many simulations get people confused, but we show how social protection would gain in accountability, mainly because the social protection choices, like the Brazilian preference for the elderly in detriment of children, they would become clearer, and society would be able, hopefully, to make better choices about that, because sometimes people, they don't really know the social protection system. They cannot grasp the privileges that are built into it. I mean, how we distinguish among groups of poor, and how this has no justification whatsoever. Next slide, please. So we are estimating, one thing that we are estimating is that we have 17 million children in Brazil that live in households not receiving any benefits. So if we take those 52 billion reais in our basic scenario, we show that it's possible today to pay a truly universal child benefit of 45 reais to all Brazilians 0 to 17 years old every month. And this is already greater than what we are paying in Bolsa Família for every children. But on top of this benefit, we can add for poor families under 250, that is much more than the 178 of Bolsa Família now, they would receive 90 per children under 5. So our model also has an implicit taxation of 50% for those above the line, so that people that are above 250, they will also receive the benefit, but decreasing. So for every 10 reais above the poverty line that the person has as income, we will deduct like 5 reais of the benefit that this family would be entitled to. So poor households without children or households that remain poor after receiving the child benefits, the universal and targeted, would still get 44 per capita. So an under 5 extremely poor child could receive 179, which is twice the maximum of 89 she can get from Bolsa Familia today. Next slide, please. So what we are showing with this simulation is that without increasing the amount of resources through smart reprogramming, Brazil can increase the coverage of the poor population, raising the eligibility threshold of Bolsa Familia, increase the value of the transfers to the poor, include 17 million children that are not covered through this universal transfer, regardless of household income. The value of this universal transfer would still be greater than that most of the existing programs are actually paying per child. The only exception would be the tax, the deduction of the taxable income that goes to the rich that pays more. But this is for the people that are in the upper bracket of taxation. And furthermore, almost no household will lose, because while some people would be losing benefits, other members, they would be receiving other benefits. So there is a sort of a substitution of benefits. Then if we do this, we could reduce the Gini far more than what we are reducing today, and reduce extreme poverty to 4%, not to 5.9%. So next slide, please. So we could do a lot more. So what we try to do in this paper that is going to be coming out soon is we sought for a new program and benefit design that would better distribute the resources without producing many losers at the household level. Because as a local politician told me once, and many politicians tell us that, people that lose benefits, they can become very vocal against the government. So politicians don't like don't like solutions where many people lose. So we are trying to make a sort of a win-win solution that few people will lose. However, there are other benefit designs that could yield even greater impacts upon poverty and inequality. And what I think is that once we have this new system in place, people will start to see that, because then we can start to do more informed ex-ante simulations of what would be if we were distributing the resources in this and that manner, and not as we are doing. So if the Brazilian society, for instance, goes Rawlsian, and it decides that what matters is the welfare of the poorest Brazilian, it can opt for a larger targeted transfer for poor children instead of a universal child benefit. Then we can have the poor children receiving like 300 reais instead of 170. So just to finish, I would like to say that this kind of reprogramming based on evidence, based on a sound analysis of the registries or the household surveys that are available, in our view, is a good approach to expand social protection in countries like Brazil. And I would say also in countries like Kenya and Indonesia, because those are countries that have administrative capacity, a well-developed state, but they also have many programs, fragmented programs, and they don't have much fiscal space. So this is something that we could be doing, like looking at what we are doing and thinking, how can we do better with the resources that we actually have, not needing to get more resources. So that's what I wanted to say. The next slide, please. This is the forthcoming paper, a proposal for the unification of social benefits for children, youth, and adults poor and vulnerable in Brazil. And this is what I wanted to say. Thank you.
Rafael, thank you very much, because I think it's very inspiring also to hear how we can rethink existing programs and design them in a more efficient way. So we received a number of questions, and just to remind you that the questions that we will not address here now during the webinar, there will still be a written document later, so we will make sure to answer all the questions. But I would like to start first with some more specific questions directly addressed to our panelists, and then I will continue with some more general questions that I think are interesting for all of you. So Mr. Maliki, a question related to your presentation was whether you could shed some more light on strategies to ensure sustainable funding of non-contributory schemes. I'm sorry, I think we cannot hear you.
Okay, I forget, it's still muting.
Thank you.
Okay, for the non-contributory systems, so we have one is totally the social assistance programs, and the other one for the social insurance, we have the supported premiums programs for the health insurance. To ensure the fiscal sustainability for the the social assistance itself, we design the programs quite carefully, where we put or we upscale the programs is on stage, and we try to also project how much actually the government burdens, fiscal burden for the next few years, especially for like a medium terms fiscal, and then how many people actually we can cover by our budgets. And in terms of the targets, because it is a staging, so we try to put the targets on the ones who is really poorest, and then on stage in the poor, and then vulnerables, and then we cover the whole 40% of the populations. For the data itself, for the targeting, we have what is so-called the unified database system that is updated quite frequently, so that we can change the targets if once the target is actually already graduated from the criteria of the poor. So and as well for the national health insurance, we have the supported programs. That one is also evaluated every year who actually will receive the programs. I think that's for the first questions.
Great, thank you. Let's maybe first continue with Cecilia, because Cecilia, there was a question directed towards you, and that was whether you could say a little bit more about the health insurance scheme. How universal is it? Does it reach the poorest? Is it contributory? Who contributes and how much?
Our health insurance takes several forms. We have the contributory, where the employers contribute, and this is based on salary, but it ranges from $1.5 to about $17. And upon contribution, the contributors can be able to access inpatient and outpatient cover. They can also access surgical services, cancer treatment, maternity, diagnostic procedures, and they can even be treated overseas. We also have voluntary contribution by for the informal sector, and systems have been put in place to enable them to contribute. Other than that, we also have a government providing subsidy programs. For example, for the cash transfer for the vulnerable children and older persons, the government has set some funds aside to cover them. It goes directly from Treasury to the National Health Insurance Fund for them to be able to cover them. The government is also in the process of rolling out a universal health cover. This is being piloted in 4 counties, and what they want to do in the pilot is to understand how much it will cost per person. And what they have done in the pilot is actually to provide the government pays directly to the hospitals to be able to provide the services, and the pilot is going to inform the rollout. Yeah, thank you.
Great, thank you, Cecilia. Maybe let's move on to Raphael. Raphael, there was one question on the political economy of delivering those multiple social protection instruments. Are there focal forces against social protection? Also, how does Brazil afford all those multiple instruments with overlapping beneficiaries? What is being done to ensure efficiency?
Well, as I said, there is this discussion within the government right now because we are going through this economic crisis. So the government, the new government, of course, wants to do something in the social area, but they don't have the resources to do it. The situation is far worse than in 2003. So people were discussing this. As I said, the political economy of promoting those changes is very hard because some of these programs are in the constitution, like the abono salarial. So you have to change the constitution. And to change the constitution, you need 3/5 of the Congress. It's very hard to get this to pass. That is why, for instance, we took the old age and disability pension out of the original proposal. If we had it in, it would be almost 100 billion reais. We could do a lot better, but the problem is that when you get to discuss the BPC was discussed in the midst of the reform, the social security reform that is happening now in Brazil, and it's a very hard discussion. For instance, we have this binary concept of disability. People are not willing to review it. Whenever you say that you cannot treat like the one-eyed and the blind with the same way, people complain, people react. It's very hard to conduct this. But there are things like the abono salarial. There is a consensus already built within the government and even in the Congress that this is a program that should be reformed and terminated. This is the biggest one out of Bolsa Família of the 4 representatives. So, but the problem is that few members of parliament have the guts to defend this in public, because then the unions come and say that, oh, you're taking out the rights of the poor workers and things like that. Although we know that these people are not necessarily poor workers, quite the contrary. But this is a thing that sometimes the debate is not grounded on evidence, but it's very hard. That's why we are doing this work. So before publishing the paper, we are going around and discussing with everyone, and when we face fierce resistance, we go back, we discuss among ourselves and see how we are going to change the proposal so that we can have the political buy-in that it needs to go forward. But right now we count with the support of the Ministry of the Economy. They are very keen on this proposal, and so we might have the government buying it, which might not be a good thing with the current Brazilian government. But anyway, I mean, you have to have the government in to make changes.
Right, thank you, Rafael. There was actually a question, and I think it would be good to hear different views on it. It was, are there any lessons learned with regard to universal social protection and scaling up of social protection systems in times of stresses, shocks, and humanitarian situations? And then following up on this was also a question, in these times of shocks, how is targeting done under universal social protection? So who would like to start answering this question?
All right, let me go. I have my mic on.
Okay.
Sorry, Maliki.
You, Mr. Maliki, is going to join us, yeah.
So how to reach everyone, this is something that we have been discussing among us, because after all, if you're going to have a universal child grant, you're going to have to reach all children, and this is certainly something difficult to do, because as I said, there are like 70 million children that are not receiving anything, and how is the state going to reach these people, these families, the families where these children are? The thing is that as I was saying, there was a huge technological development in the area of registries in Brazil. So now most of the births in Brazil happen in a health center, and when this happens, the father or mother, they get a certificate of the live birth. And this document, when it's issued, now it's issued together with the CPF. So 90% of the children, when they get their live birth certificate, they are also enrolled in the registry of the Ministry of the Economy, one of the main registries in Brazil. There is one thing that is missing, is that when the CPF is generated for a newborn, that also the social identification number, because in Brazil we have many identification numbers, also generated, because as soon as this number is generated, then we are able to identify this child, know where she lives, and she can be included in Bolsa Familia and be issued a card for the family, and the family then can go and withdraw the I'm sorry, what was the first question? Mira? Your phone is muted.
It was in times of crisis, what has been learned about scaling up social protection systems?
Oh yeah, that's very good. I think this has something to do with what Cecilia was saying about the need of having a fund for social protection. This is something that is very important, because we talk about shock responsive social protection systems, and I can tell you that Brazilian social protection is shock responsive. Whenever there is a shock, it shrinks. So it's not shock responsive in the way it should be. But why? Because when the country is growing, when there is money for everyone, we create new programs, we distribute money for the rich, for the middle classes, for the poor. But then when a crisis comes and we have no fiscal space to increase this, then we have to have a discussion on all these issues without money. So a good thing is now that we have this technological background, all the registries, and this can help us a lot to eliminate duplications and to be more efficient in time of crisis. But it's still, I think that we should definitely start thinking about mechanisms for funding social protection in times of crisis, because this is something that affects all countries.
Right. Mr. Maliki, would you like to come in? And then, of course, we want to hear also Cecilia.
Okay, actually, Indonesia has been experienced for several shocks, earthquake shocks for I think the last 2 years, 2 or 3 years, and the scaling of the social protections is not actually affected, because as what Rafael mentions, that we already have the people registrations, and then every population have this number. And it's covered almost now. It's almost like 96% of the population. So in terms of the registrations and identifications of the peoples in the shocks is quite. I think it's quite advanced. But I think what Rafael says is quite right. Is how actually we can adapt to like more changings in terms of climate change, as well as the of the earthquake. So this is the one that we are going to design on how our social protection can adapt with both all of those changes in the future. So we are designing a more adaptive social protections that will cover not only for the people but also for their assets. So then when there is some shocks, it's not only how we can help during the stress, but also they can recover economically.
Right. So, Cecilia, what is your view on this? Could you please unmute your? Thank you.
Yes, I wanted to say that as a country, we experience a lot of shocks, and especially in the arid and semi-arid areas. And for me, the most important thing is to ensure that, because of the vulnerability where you find almost everybody is very poor, is really like to almost do a census of the poor and vulnerable in those areas, so that when they're experiencing the shocks, then you really know how to respond. Previously, what we have done as a country, during drought, is to provide food. But I think the debate now is that we should think of providing the cash transfers to these people, because when you provide the cash transfers, the food will follow the cash. So I think it is important that we keep thinking outside the box on how best we can be able to address shocks, the shocks. Yeah.
Great. So I'm afraid we are already at the end of this webinar. I would like to thank you all for your presentations, for sharing your insights, but also to thank the audience for all your questions, for engaging with the panelists. So there will be a written document for all the questions that we could not address now during the discussion. And please also join our online community, because like that you will remain updated on the next seminars that will follow in the upcoming weeks. So thank you all very much and have a good day.
Thank you too, Mira.
Thank you. Goodbye.
Bye.
Bye. Bye-bye.